Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Matthew Glenn of Topeka about nasal fractures. Thanks for being here today.
Thank you for having me.
What is a nasal fracture?
A nasal fracture is fairly self-explanatory. On the proximal third of the nose, we have paired nasal bones. So this would be an injury or fracture to those particular bones.
And what about the symptoms?
What symptoms we see, typically if you're getting some injury to that nose, which can happen either through sports or an altercation, we would see that that bone has been separated from its surrounding attachments. When that happens, the internal lining of the nose typically will tear and we'll get a nosebleed or epistaxis. We'll see bruising and swelling and then some external deformity of the nose.
How do you treat it?
It really depends on the severity. Most nasal fractures will heal uneventfully and don't need treatment. Depending on the amount of deformity to the nasal bone and how much shift or the complexity of the fracture itself, then it may want us to do some surgical treatment. Typically, when we see a patient that has a nasal fracture, we want to rule out that there is a problem called a septal hematoma or a blood collection in the middle portion of the nose. We also want to look at the surrounding structures and the cartilage of the nose, and we want to look at the integrity of the inside of the nose to make sure that if we don't treat it, that breathing would be adequate. If any of these things are present, then it's going to direct us more towards surgical treatment.
How do you know if you should call your doctor?
Most people call when they have had a problem such as this. Typically, I would tell people that I would take anti-inflammatories and treat the pain and then let the swelling go down. If they see an obvious deformity or they're having trouble breathing, I would come in.
Okay, good information. Thank you for being here.
Thank you.
Please join us next week for a new health topic discussion on House Calls.